Welcome to a new episode of our weekly web series, Science in Context. Today, a paper was published in eLife on reconstructing of COVID-19 transmission in hospital settings. I'm Sabine, and joining me today is Dr. Mohamed Abbas. Mo, what did your study look at?
Our study's focus was on nosocomial COVID-19, which means COVID that was acquired in the hospital. So throughout the pandemic, there have been numerous outbreaks of nosocomial COVID that involve both patients who are in hospital for other reasons and healthcare workers. This is also true for residents of long-term care facilities who represent a large proportion of deaths due to COVID-19 in Western European countries.
And what were the main findings of your study?
First, we showed that even with sophisticated modeling techniques that combined epidemiological and genetic data, and although we couldn't precisely reconstruct the full transmission tree, i.e. who infected whom, we can still understand overall transmission patterns. So we showed that importation of SARS-CoV-2 in the acute care geriatric hospital was mainly due to healthcare workers. That has important implications when you're considering preventive practices, not only for COVID-19, but potentially for other respiratory viral infections. We also observed a lot of patient-to-patient transmission, which was especially prominent among patients who shared wards. When we looked separately at healthcare workers who cared for patients with COVID-19 and those who didn't, healthcare workers who did not care for COVID-19 seemed to transmit more to their colleagues than healthcare workers who cared for COVID-19 patients. This could be due to different infection control practices, which in turn may be due to different perceptions of risk of acquiring COVID.
Can you explain a bit more about the role of healthcare workers?
Because healthcare workers are at the interface between the community on the one hand, where they interact with family and friends, and we're not subject to stay-at-home guidelines, and the healthcare facilities on the other, where they may interact with other colleagues in non-clinical environments or patients and colleagues in the clinical environments, they can be either vectors, victims, or reservoirs of SARS-CoV-2 cross-transmission. So that means that to prevent introduction and spread of COVID-19 in healthcare settings, so hospitals and long-term care facilities, interventions that focus on healthcare workers are really important.